What's the best way of treating hooded eyelids? Hooded eyelids are one of the most common problems that we see in aesthetic medicine. The good news is that we have a couple of options for treating them, both surgically and non-surgically. Heavy upper eyelids are sometimes something we're born with, it gets worse with age, and sometimes they just happen upon us as we get older. In the most extreme examples, the eyelid skin can eventually reach on top of the eyelashes and start to obstruct the vision. It becomes almost a functional problem as well as an aesthetic problem. If you are a little bit younger and you don't have a huge amount of excess skin, then it is often possible to achieve a nice improvement just through using muscle relaxing injections to give you a little bit of lift to the eyebrows. But when you're doing that, you need to be careful. What you don't want to do is over elevate the eyebrows so that you look constantly surprised. So when I'm using toxins to try and lift the eyebrows, I always try and keep it really conservative, like literally a millimeter or two of elevation. And even if you need more than that, it's enough to make a little bit of a difference, but without making you look like Captain Spock. When the excess gets a little bit more significant, however, then we really need to be thinking about surgical options. But the good news is that of all of the surgical procedures that we do in cosmetic surgery, this is among the least invasive. It's the design of where to place the incisions and exactly how much skin to remove that ultimately determines how the final result will look. What we're trying to do is take away some of the heaviness, but what we don't want to do is lose the fullness or softness of youth. So you're kind of treading a fine balancing line here between doing enough to make enough of a difference, but without doing too much that you cure the problem of the hooded eyelids, but you make it look quite harsh. And that really is an art that varies from surgeon to surgeon. The procedure itself is actually relatively short. First of all, we inject some local anesthetic to make the skin go numb. That stings a bit, like when you go to the dentist, it's the exact same numbing injection that we use. We then use a scalpel to remove the skin, and if we take any muscle or fat, we only take a small amount. So in the olden days, doctors, as a matter of routine, took away as much muscle and fat as they thought they could get away with. What that ended up doing was creating a lot of really hollow eyelids, which is something you used to see in the 90s and noughties. So any muscle excision or fat resection that we do is usually very conservative. See, one, that the heaviness is gone, but I also want you to pay attention to how soft the contour looks. This is down to the design skills of the surgeon performing the procedure. Again, you see the heaviness is gone, but it still looks soft, and that softness is absolutely critical to having a result that looks youthful and attractive, and not just a sort of very crude result that amputates the skin but doesn't look very nice. So in a nutshell, if you are young and only have a little bit of excess skin, then injectables are going to be your number one go-to. If you have a little bit more loose skin but don't want to have surgery, you will get a bit of a benefit from injectables. But if you want the best result, a minor surgical procedure called the upper blepharoplasty is the answer. Any questions or suggestions for future content, please pop them in the comment section, and don't forget to like and subscribe to our channel.